Hi, my name is Barrington Miller, and I'm known as the Director of Issuer Engagement at the Canadian Securities Exchange. And normally on these types of shows and programs, we interview CEOs such as Timothy Coe from Entheon. But I don't want to talk today about KPIs and listings and the stock market. There's there's something bigger at hand, and I guess we've noticed that people have gotten into the psychedelic space or into the health and wellness, cannabis um, sectors for a variety of different reasons. And I kind of just wanted to peel some layers back and have a discussion with Timothy, not the CEO, and I'm not with the Canadian Securities Exchange, but just somebody who wants to learn more about the person behind the company. So, Timothy, thank you for joining this unique type of program. Um, what we're in the month of January, and there's been a big focus on mental health and mental wellness, and psychedelics and psilocybins are playing a much bigger part of that. And as we get away from opioids and prescription medications, people are um, turning towards, I guess, more traditional healing methods, which is um, something that you are familiar with and your company is familiar with. I guess the real question that I have for you is why are you here
Sure.
today?
Yeah. I think super important question. And yeah, thanks for doing this. I'm sure this is not the sort of typical type of content that we're used to creating, but I appreciate the opportunity. And yeah, we're not here to talk about KPIs and sort of financings. Those are important things, but like, yeah, I think it's really important to understand the why, because yeah, like as you mentioned, it's January. People are talking about it. Bell, let's talk. Let's have a dialogue about this. And I think the reality is that people wouldn't be talking about this. We wouldn't be recentering ourselves around mental health if mental health was something that wasn't worth talking about. But I think the reality is that we need to have a talk about mental health because things aren't good. I think the pandemic has certainly highlighted that. And yeah, I think the overdose deaths that are happening across Canada are really highlighting that too. But we didn't arrive here just instantaneously. I think this sort of a gradual mental health crisis that we find ourselves in, and the drug use, it's a drug overdose crisis that we found ourselves in, didn't happen overnight. Fentanyl isn't, it didn't just pop up overnight out of nowhere. That's premised on this idea that there was this huge population of people that were massively addicted to opiates, and that's, I think, a virtue of some of our, misguided beliefs around the lack of harm around traditional pharma. And I think, yeah, we've come to an inflection point now where it's undeniable, and I think we all have a lot of time to look at the statistics and look internally and say, hey, things aren't really great in the world, but also internally, like, yeah, I think seeing that we find ourselves in this place of social isolation, and yeah, the very fabric that holds us together is causing some of us to seek out ways of addressing this. And yeah, the sort of developed themes over the course of the last few decades have been mostly pharmacological as a course of action for dealing with some of this stuff. But I think, had those things worked, we wouldn't be having this conversation. So, yeah, I think right now this refocusing on psychedelics is a reaction to that. Sort of, there's an assessment that's been made that's supported by empirical data around death statistics and addiction statistics and rates of remission or lack thereof from traditional means of therapy. And right now we find ourselves questioning, does this really work? And if so, then why are so many people dying? But then also looking at if that is presumed that, hey, what was supposed to work isn't working, what has the potential to really help, and that's sort of where we've found ourselves.
Now, when I talk to different people, what keeps coming up is access, and access to, I guess for me, it's there seems to be a lot of people who have access and who are somewhat abusing that access, or
Mm,
being allowed to abuse it. I don't want to make it sound like I'm putting blame anywhere, because it's not the
mm,
blame game.
sure.
But I guess what can we do? I want to do more. I want us to do more than just talk. And I know talking is where it starts. But what can we do? What can I do?
Yeah.
Or maybe what should I do?
That's a really good question. So if you're talking about access for people that do suffer from, drug use issues, um, yeah, I think this recent spike, I mean, in Vancouver, month to month, we lose anywhere between 130 to 180 people per month from overdose. Um, and yeah, that's a whole set of confounding factors. But one of the things, like you mentioned, access is, right now there is disproportionate availability of really lethal drugs like fentanyl. And yeah, there's, I think, a governmental stance on access to drugs that is potentially harmful to drug users. I'm not here to debate that, but I think the reality is that due to a lack of reasonable, safe access to those drugs, people are dying at sort of unconscionable rates. And so I think that stems from potentially an ignorance towards or a callousness towards those issues. When in reality, I think, in order for us to come up with measures that help to reform people's lives and help them to recapture their own sovereignty and sort of, yeah, just come to a neutral standing from which they could make all sorts of empowered choices, the first order of business is ensuring that people don't die. And so I think, yeah, with regard to that, as people, I think we do need to open our eyes to that this is a massive public health crisis that's happening, to hold some compassion there, and to not perpetuate stigma and, sort of think of people that suffer from drug abuse issues as, getting the just desserts for their choices in life. So I think, yeah, that first eyes open approach and then having soft eyes towards a situation that's super necessary. Then we can actually start having dialogue where we don't view these people as others or people that are removed by virtue of moral failure. Because the reality is, any one of us can go to that place. And from a personal perspective, I lost my brother to drug addiction, and it wasn't due to moral failure. It was a confounding or sort of confluence of events and perpetuations of trauma and social stigma and social isolation that were only exacerbated by feelings of, not being a part of normal society. And so I think we need to have a wholesale reordering or reassessment of how we view people with addiction issues, because really, there was a point where he was just a teenage boy, like any other teenage boy I've ever met, sort of conflicted and complex and full of potential. And a simple sequence of events can change that course dramatically. And, arriving at some arbitrary point in the future where a person is in the depths of their addiction, it's really easy to make those assessments. But I know, having been present for my brother's journey, that, the road that got him there was not an easy one to travel. It was full of tribulations and personal pain and conflict and wanting to get better. But sadly, the options were limited. And so, I think as a society, the least we could do is not compound that by adding the additional weight of judgment on people with those issues.
Well, thank you, Timothy, for sharing, and for your insights and your wisdom. Um, and again, the purpose of this is just to talk, and um, even though this is called CSE Talks, um, it's just Barrington talking with Tim. And, you know, if you know somebody out there, for our listeners and our viewers, if you know somebody, just reach out, have a conversation, see how they're doing, and, you know, take that first step and realize you're not alone. Uh, so, Tim, thank you so much for that. Again, I've been your host, Barrington Miller. This has been a modified episode of CSE Talks. Thank you.